Unusual low blood potassium levels are the hallmark of the medical illness known as hypokalemia. For your heart, muscles, nerves, and cells to function properly, potassium is a necessary electrolyte. Hypokalemia can cause a wide range of symptoms as potassium affects so many different body processes. Palpitations, exhaustion, constipation, irregular heartbeats, and muscle weakness and cramping are some of the signs of hypokalemia. Even though the majority of instances are mild to moderate, the symptoms might vary in intensity. Of all the electrolyte diseases, hypokalemia is among the most frequent. A low potassium diet is not the cause of hypokalemia in the majority of instances. Usually, medical problems like diarrhea, vomiting, or excessive perspiration cause the condition to worsen. By recognizing the signs of hypokalemia, you may be able to receive the necessary diagnosis and therapy to address the underlying medical condition causing your symptoms. Potassium is an essential mineral that is necessary for the maintenance of many essential bodily processes. It is necessary for nerve function, fluid balance, and the healthy operation of all muscles, including the heart. Many people ignore the significance of potassium in their diets, which can result in a deficiency that can have serious health consequences. A vital component of keeping yourself healthy is being aware of your body's requirements. You can make better decisions about your diet and lifestyle by being aware of conditions like potassium deficiency, which can develop silently and frequently present as minor discomforts. It is critical to identify these warning indicators as soon as possible. The following are the 8 crucial signs to watch out for. Number 1, muscle weakness. Hypokalemia can cause muscle weakness, which usually begins in the legs and progresses to the upper body muscles. Under extreme circumstances, the weakness may become so severe as to cause paralysis. The weakening may cause additional symptoms, depending on which muscles are impacted. For example, you may have symptoms such as nausea and vomiting if the muscles in your gastrointestinal tract are weak. Severe respiratory muscle weakening can lead to life-threatening complications, such as respiratory failure or even death. Because potassium is necessary for the correct operation of muscle cells, including the contraction and relaxation of muscles, muscle weakness results. Low potassium levels make it harder for muscle cells to perform as intended, which leads to weakness. Along with weakness, you may also have muscle spasms or cramps. In extreme situations, muscular injury may also occur. Your muscle tissue may break down and cause you to feel weak and in pain. This condition is known medically as rhabdomyolysis. Number 2, constipation. Constipation can result from low blood potassium levels. Potassium is involved in muscular contractions all over the body, including the muscles in the digestive tract, which is why this sensation manifests. The regular rhythmic contractions of the intestines that move food and waste through the digestive system might be impacted by low potassium levels. Hypokalemia can cause the muscles of the digestive tract to contract less forcefully than they should, which can impede the passage of feces through the intestines. Constipation may result from this prolonged transit time. Number 3, fatigue. 1. Common symptom of potassium deficiency is not simply feeling tired. It can seriously interfere with your everyday activities and is a deep, ongoing tiredness that does not go away with rest. The following information is essential to know. Persistent tiredness. This fatigue lasts longer than normal fatigue and does not go away with rest. Lower energy levels. Even if you have not worked too hard, you could still feel exhausted. Impacts day-to-day activities. Low energy makes simple tasks seem more difficult to complete, not just physical. Concentration problems and other signs of mental exhaustion may also arise. Beyond slumber, low blood potassium levels can cause constipation. This feeling arises because potassium is involved in the contraction of muscles throughout the body, including the muscles in the digestive tract. Low potassium levels may affect the regular and rhythmic contractions of the intestines that move waste and food through the digestive system. The muscles of the digestive tract may contract less forcefully than they should due to hypokalemia, which may make it more difficult for feces to pass through the intestines. This extended transit time may cause constipation. Potassium is key to converting nutrients into energy, so when levels are low, it's no surprise that one of the first things you'll notice is a persistent sense of tiredness. Number 4, heartbeat irregularities. Your heart may seem to be racing or skipping beats if there is a slight decrease in potassium levels in your blood. Palpitations are the term for this. An abnormal heartbeat or arrhythmia can result from larger reductions in blood potassium. The electrical signals that control the heartbeat depend on potassium to remain intact. Disruption of these signals by low potassium levels can result in arrhythmia. If you have arrhythmia, other symptoms you can experience include lightheadedness or fainting. Those with heart disease or advanced age are typically more vulnerable to arrhythmias linked to hypokalemia. Number 5. Numbness and tingling. These feelings, which are frequently referred to as pins and needles or loss of feeling, can be brought on by several things, including uncomfortable sitting postures and underlying medical disorders. Here are some things to be aware of. Needles and pins, the sensation in your limbs that you know as falling asleep. Numbness. Parts of the body may feel less sensitive or numb, especially the hands and feet. Frequency. These feelings occur more frequently than usual. Irregular event. They can happen in the absence of any clear causes like pressure. Spread. Although it can start in the extremities and spread to other body parts. Nerve function is greatly impacted by potassium. These unpleasant feelings may result from nerve signals being disturbed when their levels are low. If tingling or numbness occurs frequently, it may be worthwhile to check your potassium levels. Number 6. Polyuria, frequent urination. The disorder known as polyuria causes excessive urination. The kidneys are in charge of maintaining your body's electrolyte and fluid balance, as well as eliminating waste from your urine. Decreased potassium levels can affect the kidney's capacity to concentrate urine and maintain the proper electrolyte balance in the blood, which can result in more frequent urination. Additionally, polydipsia, an increase in thirst, may be apparent. Lower potassium levels can result from frequent urination. As a result, it's crucial to consult a medical practitioner if you observe an abrupt shift in your frequency of urination. Low potassium might occasionally affect your kidney's capacity to control the fluid and electrolyte balance in your body. You might feel the need to urinate more frequently as a result. Number 7. Breathing difficulties. Breathing problems, which manifest as shortness of breath, chest tightness, or rapid breathing, can be upsetting and interfere with day-to-day activities. It is critical to identify these symptoms. Shortness of breath, breathing heavily, especially when engaged in activities. The feeling of tightness, a feeling of constriction in the chest, rapid breathing, breathing more quickly than usual without making any physical effort. Unexplained coughing, coughing occasionally for no apparent reason. General discomfort, breathing difficulty, even when at rest. These muscles may not function properly when levels are low, which can cause breathing problems. It is advisable to think about your potassium intake and see a doctor if you are experiencing any of these symptoms without a clear cause. Number 8. Mood changes. Your daily life can be greatly impacted by mood swings, which can range from depression and unexplained mood swings to feelings of irritability and anxiety. They may appear in several ways. Irritability, experiencing unusually high levels of irritability or irritation. Mood swings, experiencing sudden, inexplicable mood swings. Depression, feeling depressed and losing interest in or drive for activities. Anxiety, an increase in unexplained anxiety or nervousness. Difficulty concentrating, having trouble concentrating or staying on task. The brain requires potassium to function properly, and a shortage can have an impact on your mood and mental clarity. These adjustments may appear small at first, but they may have a big effect on your daily activities. It may be time to check your potassium levels if you experience these changes in mood in addition to other symptoms. Symptoms in children. The majority of kids won't show any symptoms until their blood potassium level falls below the 3 mEq level. Similar to adult symptoms, hypokalemia in children can include muscle weakness, cramping in the muscles, constipation, palpitations in the heart, and kidney malfunction. Respiratory failure or death may result from muscle weakness that affects the respiratory muscles. Get in touch with your healthcare provider for an assessment and advice if your kid exhibits sporadic seizures or severe muscle weakness, particularly if there is a family history of periodic paralysis. When to contact a healthcare provider. If you are experiencing extended attacks of diarrhea or persistent vomiting, you should think about getting in touch with a healthcare specialist at once. Additionally, if you are experiencing hypokalemia symptoms and are currently using diuretic drugs, think about seeking medical advice to find out how much potassium is in you. Your blood, the medical professional could prescribe a blood test. Your doctor could advise taking oral potassium supplements and consuming meals high in potassium if your hypokalemia is mild. Citrus fruits, root vegetables, fruits from vines, and leafy greens are foods high in potassium. Potassium may need to be injected intravenously, IV, in cases of severe hypokalemia. The key to maintaining potassium levels is a balanced diet, conscious lifestyle choices, and knowledge of how medications or medical conditions may affect them. A key component of your overall health plan is this journey toward maintaining healthy potassium levels. Small, steady steps toward a healthier lifestyle are more important than big, abrupt changes. So implement these suggestions into your daily activities and watch the positive effects materialize.